handog para sa aming mga miyembro ng MIMBA, MFI, cooperatives, bank partners, RMSI at 3-man-C network. Mula sa PhilCare at RMSI, narito na ang abot-kayang healthcare program, Yakap, Yamang Pangkalusugan, Angkop para sa Pamayanan, na pwedeng gamitin ng mga miyembro na may edad na 18 to 65 years old. Sa loob nito ay may iba't ibang benefits na maaaring umabot hanggang 60,000 pesos. May mga benefits kagaya ng outpatient care para sa mga konsultasyon, lab examination at diagnostic procedures hanggang 10,000 pesos annually na maaaring magamit sa mga designated primary care clinics sa buong bansa. Kasama na rin ang unlimited telemedicine gamit ang HeField Digimed app para sa mas convenient at accessible na online medical consultation, emergency care para sa mga aksidente at iba pang biglaang sakit na nagbabanta sa buhay. Hanggang 10,000 pesos ang ER coverage per incident na hindi lalagpas ng 30,000 pesos annually. Confinement sa room and board na ward para sa mga sakit kung saan kailangan manatili sa ospital. Kasama na sa coverage ang hospital bills at professional fees ng doktor na aabot sa 60,000 pesos per illness kada taon na maaring gamitin sa higit na 500 affiliated hospitals nationwide. Financial assistance up to 20,000 pesos at karagdagang tulong pampinansyal na aabot sa 10,000 pesos kung ang 18 to 65 years old na miyembro ay binawian ng buhay na sanhi ng sakit o aksidente. Kasama na rin ang karagdagang benepisyo katulad ng dental care at taunang regular checkup or annual physical exam or APE. Isang yakap lang ang kailangan para protektado ang inyong kalusugan. Para sa karagdagang impormasyon at pagsali sa programang ito, maaring tawagan ang RMSI sa mga sumusunod na numbers.
Welcome to The Doctor is In, a program that will help you understand how vital our health is. Nothing can compare to the value of being healthy, as it allows us to pursue our dreams and achieve our objective. Health is the foundation of everything, and without it, no amount of wealth or other benefits can make our lives meaningful. If our health is poor, our lives will suffer. To enjoy a quality of life, we need to be mindful and balanced in meeting our needs and preferences. Quality of life is essential for our happiness and well-being. Mga ka-people, we also need to be considerate of the quality of life of others who may face health challenges. By doing so, we can foster a state of happiness for ourselves and others at all times. Before we begin, I would like to acknowledge our CPMPC staff, our President and CEO, Mr. Brian Yap, our Chairman of the Board, Mr. Manolito Ardemir, and all the BOD members, our branch managers. Good afternoon, and thank you for joining us. Our topic this afternoon is all about prevention, specifically about preventing chronic diseases. Preventive care for chronic diseases is the practice of taking steps to avoid or reduce the risk of developing or worsening a chronic diseases. But before we proceed, let us pause for a short reminder.
Mabilis lumaganap ang dengue. Mag-abakada, Aksyon Barangay kontra dengue. Hanapin at linisin sa tahanan at bakuran ang maaaring pamugaran ng lamok. Butasan ang mga lumang gulong o lagyan ng lupa. Takpan ang mga drum at timba. Palitan ang tubig ng klorera 2 beses sa 1 linggo. Alisin ang tubig sa paminggalan. Linisin ang mga alulod. Itapon ang mga bagay na maaaring pangitlugan ng lamok. Magpatingin sa health center kung may lagnat na ng 2 araw. Gawing dengue-free ang inyong barangay. Mag-Aksyon Barangay kontra dengue. Isang paalala mula sa inyong DOH.
Hindi porket wala kang nararamdaman,
wala kang sakit.
Manigurado!
Magpa-urinalysis ka.
Kayang matukoy ng isang simpleng urinalysis kung meron kang diabetes, hypertension o iba pang sakit o karamdaman na pwede pang lumala. Dahil walang kapalit ang peace of mind, magpatingin ka na habang maaga.
Huwag mo nang patagalin pa!
Magpa-urinalysis ka na.
Buti na ang maingat.
Kesa magsisi.
Welcome back to The Doctor is In. As I've said, our topic this afternoon is about prevention of chronic diseases. So chronic diseases are also a health problem that would last for a long time and we do not go away completely. So kung naatay mga chronic diseases like COPD, heart diseases, or lung diseases, then it will stay on our body and it will not go away completely even if there is an ongoing treatment. So a chronic disease is a long-term health condition that cannot be cured but can be prevented or controlled. So mauna unsaon nato pag likay or pag-prevent nga dili ni siya mo grabe or muhatag og mga komplikasyon sa atong lawas if we develop this type of diseases nga gitawag nato og chronic diseases. So mga examples of chronic diseases are kanang gitawag nato og mga heart problems or stroke, cancer, lung problems or pulmonary diseases, diabetes, as well as mga mental health problems. So unsa man siyang heart diseases or stroke. So these are when ang atong mga blood vessels nga nagdala sa atong dugo paingon sa atong kasing-kasing paingon sa atong brain would be blocked or bubuto or burst out. So this can cause death or disability. So these heart problems or any heart diseases and stroke is the most common cause of death in the world. Next slide. Now, ang sunod ana is kaning gitawag nato og cancer. So this cancer it will develop if the cells sa atong body would grow too fast and out of control. Kay kini atong lawas are composed of cells. Now, kaning cells sa atong lawas, if they grow out in proportion to the needs sa atong body, then it can spread to the other parts of the body and would cause damage. And then, mo develop ni siya og different kinds of cancer. Chronic respiratory diseases or mga lung problems. For example, asthma, COPD or chronic obstructive pulmonary diseases. These are when ang atong agianan or tubo sa atong pagginhawa would be swollen o mubaga or narrow, which would lead to difficulty of breathing. Okay, mao na ang layman's explanation kung unsa ning chronic respiratory diseases like asthma or COPD. Ang next nga chronic diseases is ang gitawag nato og diabetes. So, unsa man ning diabetes? Very common ni siya sa mga atong mga people. This is when the body cannot control the amount of sugar in our blood. So daghan kayong mga sugar sa atong body that can cause problems that would lead to kidney problems, eye problems, or even sa atong lower extremities. So mao na nga we have to control our diabetes if that would not lead to complications on our kidney, our heart, or eyes as well as our lower extremity. Ang ikalima mao ang gitawag natong mental health problems. Example of mental health problems kanang mga depression or anxiety. So these are when the feelings, ang atong thoughts or atong actions of a particular person are affected in a negative way na makakause of mental problem. And they can make it hard to cope every day if naay mental problems nga sa usa ka tawo. So these are examples of chronic diseases. Now, these chronic diseases can be prevented or can be controlled. However, it cannot be cured, but there are already the medications nga pwede na tumaron to control these chronic diseases in order not to cause complications sa atong lawas. Okay, next slide. Now, these are ways nga makatabang to control chronic diseases. Kaning lifestyle changes, screening test, o education and counseling. Okay. Now, kaning mga tulo kas akong gi-mention can be considered as a way of preventing chronic diseases and controlling it in order it will not develop complications to the different parts of our body, either diabetes, COPD, heart, mental problems, or cancer. Now, number one is lifestyle changes. So, usa may lifestyle changes nga ato yung i-follow para it would not lead to complications to the different chronic diseases. Number one is balanced diet, eating healthy food. It should be balanced, nga composed of fish, meat, vegetables, fruits. Dili kay usa ka klase atong kanon kada adlaw o kada pagkaon nato usa ka klase. Kinahanglan nga it should be a balanced diet, eating a healthy food as well as eating a balanced diet. Then we should have a body that is being physically active. We should go exercise or ato kat sa mall, magsuri-suroy ta, or swimming, or we engage in any sports activity para our body could be physically active. Then, gibalik-balik nato ni as part of preventive measures of any type of diseases is to quit smoking. Okay, sige na ito gibalik-balik nga we have to quit smoking because it would not di siya makahatag nato og kaayuhan sa atong lawas because smoking or a simple cigarette are composed of mga chemicals that are deadly to our body. It would not help our body if we keep on smoking. That's why it is important nga we have to quit smoking para makalikay ta sa mga nagkalain-laing sakit sa atong lawas. Now, if it is hard for us to quit smoking, then we have to enroll ourselves to any of the smoking cessation clinic, either sa private facilities or government facilities. Naanay gitawag og smoking cessation clinic para makatabang nato paglikay o pag-stop to smoke. Then, limitation of alcohol. Okay, usa sa na nga atong ilimit ang pag-inom. It is not also good nga we keep on drinking alcoholic beverages because that would also lead to any type of diseases sa atong lawas, especially sa atong liver, that can also complicate. Then, last of our lifestyle changes is we have to get enough sleep. Dili ta kay sigar tag dugay ta matulog magabi because that would also lead to pagkakapoy the following day kung kuwang ta sa tulog. Okay. Now, so those are the lifestyle changes that we have to follow. We have to eat a balanced diet and nutritious food. We have to be physically active. We have to quit smoking, limit alcohol intake, and we need to have 8 to 10 hours sleep every day. Okay. Ang next preventive care for any chronic diseases are the screening test. Unsay mga screening test nga we have to know or we have to follow para mahibaw-an nato kung wala ba ta, kung wala ba may komplikasyon ang atong mga existing chronic diseases. Number one is taking of blood pressure. Okay. We must know na importante nga mahibaw-an nato ang atong blood pressure para matagaan ta og tambal if our blood pressure is high or tawag nato og hypertension. Because once our blood pressure is high, we need to take anti-hypertension or hypertensive medications. Muna nga, it's advisable nga magpa-blood pressure ta para mahibaw-an nato kung naabatay taas ba ang atong blood pressure. Next is cholesterol. We need also to know kung taas ba ang atong cholesterol. So, saan man nato pagkahibalo kung taas ang atong cholesterol is we have to undergo blood test. Maadto kita sa laboratorio, magpakonsulta usa ta sa doktor, tagaan tag request for cholesterol testing determination. So once na natay request, maadto ta sa any laboratory and submit ourselves for test for cholesterol. And not only cholesterol but also blood sugar para ma-monitor nato ang atong diabetes if controlled na ba ang atong blood sugar or wala. Because if it is not yet controlled, then we need to take medications para to prevent complications like complications sa eyes, sa atong kidney, or sa atong lower extremities. Okay. So kung kinahanglan nato magpakonsulta ta sa atong diabetes and then we have to monitor it, then we need to request for a laboratory test for blood sugar. Ang gitawag na itong FBS, fasting blood sugar. Then, ang cholesterol. Then, aside from those tests, we need to undergo screening test for cancer. Because, as we've said, cancer is sometimes hereditary to the family. Para mahibaw ta kung dili ba kaliwat nato ang cancer, we have to undergo some screening test para mahibaw-an nato kung wala batay mga abnormalities atong lawas that would lead to cancer. So naay daghang mga cancer screening test either sa babayi or sa lalaki that we can avail, especially if it is within our family na natay mga kaliwat og cancer. Okay. Now, this screening test is one way of detecting early to prevent chronic diseases to develop complication. And these are the things that is also important to identify those mga risk factors. Now, aside from the screening test, we have these vaccinations. Now, vaccination or immunization is also important. Dili ta mahadlok magpabakuna because ang pagpabakuna is a preventive measure to prevent mga infectious diseases nga mo takod sa atong lawas. Unsa may example of vaccinations that we need to receive even if we are already adult. Okay, number 1 is flu. Okay, so kung mahimo magpa-flu na ta karong panahona because wala pa'y rainy season. So the best time to receive flu immunization is karong mga buwan na January, February, March, or April. So naanay mga baligyang flu shots that we have to avail. Or base na apay mga libreng flu vaccine sa atong mga barangay, then we have to avail for that flu vaccine para paglikay sa umaabot nga mga rainy season nga makahatag nato og sakit like flu or influenza. Another one is pneumonia. Okay, naay gitawag natong pneumococcal vaccination that we can also avail for this. Ang pneumococcal vaccination daagya po'y libre sa atong mga barangay and we can avail for that because ang pneumococcal vaccination is mahal-mahal sad ni. Then if there is a vaccination or vaccine available sa atong barangay health center or district hospital or government hospital, then we should avail for that because that would really help us prevent such mga chronic diseases or any type of diseases. Okay. Then, of course, katong COVID-19 vaccination. Now, we all know nga this is a novel virus and then we were able to receive those COVID-19 shots. Pagkakaroon, walay available nationwide on COVID-19 shots. So katong wala pa naka-booster, so dili pa ta makahatag og COVID-19 vaccine for their booster because wala na available diri sa Pilipinas. We are still waiting for the availability of COVID-19 vaccine. So again, all the vaccinations that I've mentioned like flu, pneumonia, COVID-19 protects against infectious diseases that can worsen our chronic diseases. Muna nga importante kayo kung natin mga chronic diseases, muna yung gitawag na itong mga comorbidities, we need to avail mga vaccination or immunization para to prevent complication, especially if we already have these existing chronic diseases. Okay. Ang ikatulo, next slide, is education and counseling. Okay, unsa man siyang education and counseling? This is a learning process nga makig-istorya ka sa imong doktor, makig-istorya ka sa mga healthcare providers about different diseases, about your existing diseases, on how to control it, how to prevent it, how to prevent the worsening, to prevent complication. So, we need to be educated. Ang mga pag-istorya ninyo diha, mahibaw-an ninyo all about how we are going to prevent this type of diseases para dili na mo-worsen or mo-lead to complication. So, muna nga importante kayo ang imong family history, kung kinsay mga sakit sa inyong pamilya nga maka-lead to chronic diseases also. Then we need to be counseled or we need to be educated para to manage stress as well as other types of illnesses. So, mauna nga importante kayo nga through education and counseling, we could follow the doctor's advice. Because through this advice sa atong doktor, makahatag og maayong panglawas sa ato. No. So, these three, education and counseling, screening test, and lifestyle changes, mao yun siya importante in order to prevent our chronic diseases to be worsened or that would lead to complication. Next slide. Okay. So, unsa may makuha nato if we have to practice or the advice of our doctors regarding chronic diseases. So, through preventive care, it would help improve the quality of life. Muna nga, importante kayo nga di nato pasagdan ang atong lawas, kinahanglan nga magpakonsulta ta regularly, especially if naatay chronic diseases. Because we want to prevent complications or worsening of that particular disease. Number 2 is it lowers our healthcare costs. Because kung dili ta magpakonsulta regularly sa atong doktor, dili ta mo avail sa mga immunization, especially kung libre, then once magkasakita, it would lead to financial crisis sa atong pamilya. Muna nga, importante kayo nga magpa-konsulta ta before ta magkasakit para ma-prevent nato ang mga complication, especially sa akong ingon kung naatay chronic diseases. Then, number 3, it prevent serious complications from chronic diseases. Muna nga, kung naanatay chronic diseases like diabetes, COPD, asthma, cancer, then or any heart diseases, then we need to undergo mga sa akong gitawag nga mga screening test, lifestyle changes, education and counseling para to prevent serious complication. Aron dili na ni mo abot sa ato nga complicated na ang atong mga sakit, na anay mga complication gawas sa other parts sa atong lawas from chronic diseases. Okay, mauna nga kinahanglan nga magpakonsulta yun ta. Dili lang ta magpakonsulta kung na natay sakit, but magpakonsulta ta especially kung na natay na-identified nga chronic diseases sa atong lawas. Because as I've said, chronic diseases can be controlled, but naani yun na sa atong lawas. Okay, so before we proceed, let us pause for a short reminder.
Nakakatakot malaman na mayroon kang diabetes. Pero huwag magpanik dahil pwede ka pang magkaroon ng malusog at mahabang buhay. Ganito kasi yun. Pag kumakain tayo, napupunta ang pagkain sa tiyan na binubuo ng 3 nutrients. Habang nadadigest ang ating pagkain, ang carbohydrates ay nagiging sugar o tinatawag ding glucose. Ang mga pagkaing may carbohydrates ay tulad ng kanin, tinapay, pasta, root crops, prutas at gatas. Sa normal na proseso ng digestion o pagkatunaw ng pagkain, dadaan ang sugar sa bloodstream o daanan ng dugo papuntang muscle at fat cells. Pero hindi ito mangyayari kung walang tulong ng insulin na nanggagaling sa pancreas o lapay. Ang insulin ay parang susi na binubuksan ang muscle at fat cells para makapasok ang sugar na nagiging enerhiya ng ating katawan. Sa ganitong paraan, nare-regulate ang blood sugar sa ating katawan. May 2 klase ng diabetes. Una, ang lapay ay hindi nakakapag-produce ng insulin o tamang dami ng insulin. Ito ay karaniwang nakikita sa mga bata pa lamang hanggang sa kanilang pagtanda. Pangalawa, ang insulin ay di tinatanggap ng muscle at fat cells na nagiging dahilan ng pagkaipon ng sugar sa bloodstream. Ito ang pinakakaraniwang klase ng diabetes na maaaring makuha dahil sa hindi malusog na pamumuhay o hindi pangangalaga ng kalusugan. Dahil dito, maaaring maranasan ang 3 Ps. Ang 3 Ps ay ang sumusunod: labis na pagkapagod, pagkauhaw, at pagkagutom. At kapag ito ay naranasan, maaaring kailangan ng kumonsulta sa pinakamalapit na health center upang masuri ng doktor. Kung di makokontrol ang blood sugar, maaari itong mauwi sa mga komplikasyon tulad ng pagkabulag, pagkaputol ng kamay o paa, sakit sa bato, sakit sa puso at stroke. Para mapigilan o maiwasan ang mga ito, bawasan ang pagkain ng matatamis tulad ng cake, candy, chocolate, ice cream at soft drinks. Isa pang paraan ay ang pag-eehersisyo na hindi bababa sa 30 minuto sa isang araw, 5 araw sa isang linggo. Kapag natuklasan na mayroong diabetes, asahan na magbibigay ng reseta ng gamot ang doktor na kinakailangang inumin araw-araw kasabay ng regular na follow-up check-up upang masigurado na kontrolado ang blood sugar at maiwasan ang komplikasyon. Maaaring pumunta sa pinakamalapit na health center upang masuri at para sa libreng gamot na handog ng Department of Health. Kaya, eat tama, tandaan ang trio. Regular na ehersisyo, iwasan ang stress, o no sa bisyo. Huwag pa diabetes sa tamis. Huwag pa diabetes sa tamis.
Going back to the doctor is in. So sa atong topic this afternoon, prevention is really important than a pound of cure, specifically on preventing chronic diseases para it would not lead to complication. So preventive care for chronic diseases is a practice of taking steps to avoid or reduce the risk of worsening chronic diseases that would lead to complications. So I hope na atin natkatunan sa paglikay og mga nagkalain-laing komplikasyon. Okay. Nothing is more vulnerable than our health, and it is better to prevent illness than to treat it. As we grow older, we face the threat of diseases. So the key to longevity lies within us and our bodies. So good health means not only being free from sickness or being cured from sickness, but also having our physical, mental, spiritual, and social well-being. So let us keep ourselves youthful and healthy. Let us demonstrate how to improve our well-being and really appreciate the lifestyle. So this is Dr. Chris. The doctor is in. See you until next time. Thank you.